Hi, this is Kareen with Kareen & Company. Today I'm going to be working on a client who has discomfort for abducting and adducting. She has a little bit of difficulty with pain, so I'm going to use my Kansa wand and some oil to help remove some of this discomfort. You don't need a lot of oil, just enough to keep it moist. And if you come around, I'll go ahead and start. I'm going to work on the anterior deltoid. Does that hurt at all? Not. Yeah, and then we're going to go the middle deltoid and the posterior, and then I'm going to come up here to GB21, and I've really got to kind of release all this tension and tightness up here. So you don't put a lot of weight into it, and you want to make sure you pull the skin taut so you're not dragging it back and forth. You want to make sure you go with the muscle, and then you're going to go against the muscle. So a lot of times right here, this deltoid tuberosity is where the insertion is, and then this muscle to the clavicle, the lateral 1/3, the acromion process, and the scapula here is where there's connections, where the origin is, and that allows for the lifting, moving. So you really want to go gentle. You want to, how's the pressure with this? It's okay? All right, so what I'm hoping to do is get to a point where, let me know where you have pain so I know where your pain spots are. Is that painful? Oh, okay. No. Yes or no?
A little bit, yeah.
Okay, so tell me where there's some really painful areas. In here at all? Mm-hmm. Okay, that's pretty much where the deltoid tuberosity is. It's a triangular muscle and it attaches here. So a lot of times there is discomfort there.
Sore.
Yeah, and you can kind of feel it. If I were to needle it, I'd needle there, there, and I'd get a couple more points. But you can really work it out with the Kansa wand. Just be really mindful, be really slow, be very gentle. You can feel like there's little nodules in here. You can feel it. You see how I'm just pulling the skin taut? Make sure you just pull it taut. Make sure if your client says that's really uncomfortable, that you really back off, because this is all about helping them feel better, not worse. A little bit of time and energy into it, just releasing the muscle fibers, will help reduce the discomfort and pain. And at that point, you can ask your client, can you go a little bit deeper? And when they have less issues of discomfort, then you can put a little more energy into it. Again, this is just using the Kansa wand on the deltoid and GB21 here, because this is a really nice relaxing point for the neck and the shoulders and the arm.